I've been in practice for 43 years. At my age, I just want to slow down and perhaps work for somebody else. It's a decision that's very difficult to make. About a year ago, I started thinking about this. 6 months ago, I met Dr. Benso, met his wife and family. I said, this could be a good fit. Then the more I got to know him, I realized his skill set and his personal feelings about making the patients feel comfortable and so forth is pretty much in line with mine. And the more I talked and got to know him, I felt pretty comfortable about this decision. I know my patients are going to enjoy him and also receive his great services. He does more procedures than I do, so it will give some of my patients an opportunity to stay in the practice rather than go to specialists and have the work done. I love my patients, and to pass their care on to somebody that I have confidence in makes all the difference in the world. I like making my patients feel safe, and I know he can carry on in that tradition. He's kind and caring and knows his dentistry, and he's been around a while. They're going to be in good hands.
I'm Dr. Shawn Benso. I'm from Broken Arrow, Oklahoma. I initially became interested in dentistry when I had braces. To have wires that could change someone's life, I just felt compelled to try and do that for someone else. I was so interested in that. So that's how I initially became interested in dentistry. I feel like what makes me a great dentist stems back to my grandfather being a pipe fitter in Kansas back in the day, having to fix things with what he had to work with. And it was definitely always thinking outside of the box. When I was young, he was a huge part of my life. So I got to see firsthand things around the house or the cars. That's what's helped make me become a great dentist, because I do think outside the box and giving patients options and saying that there's not always just one answer or one solution. I wanted to be able to do all the types of dentistry that I have to offer the patients. And I love patients being able to have options with the training that I've had, starting out with orthodontics and getting into implants and bone grafting and tissue grafting and sinus lifts, now sleep apnea. We're able to change people's lives and save people's lives. My goal is to give someone the smile, both aesthetics and function, that they have been waiting their whole life for. I love being able to do that. When people think about dentistry, they think of serious procedures or treatment or doctors, and I'm all about top-notch dentistry. But at the same time, I like to have fun. How did I find this practice at Happy Valley Towne Center?
Could you make that face again?
I don't know.
What did he do?
Should I say that? Organic?
Do you normally say organic?
No.
I've got to tell you something. I tried to lead into a serious thing. Okay, let's take
What is that?
I don't know, it's supposed to be an arrow.
Well, I was going through undergrad. Cut.
How you feel?
Tired.